I really have to give a shout out to Winnie Lee and to Lori for inviting me and kind of like helping me prepare for today. But also I went on to the AMA website and I was like, okay, Women in Medicine Month. I should know something about this if I'm gonna speak on it. And so this is their, part of their media campaign. So this is a free slide. I'm not stealing any copyrighted material. This was in their list of images that you could use as part of your Women in Medicine Month. And I was like, great, stealing it for the title slide. Because one of the things I've learned over the years is, we work hard enough. And if somebody else has already done the work to make something cool, I'm totally going to steal that. So I really can't thank you guys enough for inviting me today. This should take less than an hour, like based on my practice times, but sometimes when I speak in public, I slow down. Sometimes I speed up. So welcome to whatever we're gonna hear. So why me? Why me? And I don't ask that as like some sort of like self-pity, why me, Lord? No, I ask that because what is it about my journey that might be helpful? Well, okay, so I meet the two qualifications. I am a woman and I am a physician. And also, I don't know if we needed to do this, but I have no financial disclosures because I work at JABSOM. So, but honestly, anytime we give a talk, one of the most important questions we have to ask ourselves before we give that talk is, why me? Why does the audience need to hear from me? And I'm hoping that by the end of this talk, you feel that I was a worthy choice. If you don't, you can complain to Lee and Lori and everyone else. So this quote by Helen Keller, I'm going to read out loud because it really means a lot to me. Character cannot be developed in ease and quiet. Only through experience of trial and suffering can the soul be strengthened, ambition inspired, and success achieved. So this quote was actually one that I don't even know what book I found it in, but I found it in a book. And I, back in the old days, you Xerox things, Xeroxed it, and it hung above my desk for years and years and years. I finally took it down when I moved to JABSOM because, I really have suffered enough. And so we're looking for new quotes. But my journey is one where I've had the opportunity over the last several decades to reflect on it in a couple of different venues at a couple of different times. And honestly, every time I tell the tale, I feel like somebody's expecting to hear this, very ambitious drive that got me from point A to point B to point C, and it's not like that at all. So there will be definitely a discussion of some suffering, but I do share those details not, again, to make you feel uncomfortable or to make you feel sorry for me, but just to let you know that challenges are the things that make us who we are, and they really do help us define our priorities. So this is kind of like one of my favorite pictures from my baby years because I was, out cold right after eating a meal, which is pretty much true to form today, right? So the Cadet attack started at an early age. But really, what was it that took that sleepy little baby to become a West Point cadet? Like, seriously, what is up with that? But again, like you want to talk about trial and suffering, 4 years at West Point is an incredible way to accomplish that. I truly, truly had no idea what I was getting into. And I think, Lee and I talked about that yesterday. Like, literally did not know what I was getting myself into. So, how did I do that? So first we have to start with the beginning. Everybody's beginning starts usually with their family. And when I was in my master's program, we had an opportunity to kind of like write our biography for one of our classes. And so I, had to do some deep exploration. So I grew up in Ohio. I am adopted by Charles and Mary Jean Hagan. My brother Kip and I were both adopted. So my parents suffered from infertility, could not get pregnant. Back in the 1960s in the state of Ohio, there were many girls who actually were forced to give up their babies for adoption. I have no idea what my origin story is for that, but I know that I landed in this family. So, you look at that picture of my brother and I, we look like we get along really well. Yeah, not so much. He kind of hated me. And I think one of the reasons he hated me is because I was a smart kid. I always knew the answers. I always got the good grades. And he was kind of a mess up, So you look at the second picture, this is like early 70s, that's, early 80s. And he never met a substance he didn't like. So we just really divergent pathways. And my poor mother, she was like, gosh, I raised them both. I thought I did the same things. We were just different. So, where does luck come into it? I was talking to somebody earlier about how luck is going to be kind of woven through my whole talk. The luck of getting adopted by a middle-class family in a good town with good schools and good access to sporting activities. Like, I had it all. Of course, growing up, I didn't think I had it all because we were middle class in a town that had a lot of people that were not middle class. It was the disparities that I felt were just kind of like, I always felt awkward. Like everybody had more, everybody knew more, everybody did more. So I became an athlete, and we got to kind of look at how that evolved and what it did for me. Part of the thing that is built into this journey is again reflected in the time frame. Like I said, 70s, early 80s, huge recession in our country. People were going away to college, coming home with 4-year degrees and not getting jobs. And I was like, well, I do not want to work at the down, Rexville McDonald's the rest of my life with my 4-year chemistry degree. Like, I knew I wanted to get a degree in chemistry, but I'm like, I do not want that to be my journey. So, maybe there was a little bit of intentionality in note to self, figure out how to have a job guaranteed after college. Yeah, that was something. That was something. So I talked about sports a little bit. My mom tried from a young age to figure out what I might be good at. We tried ballet, yeah, not so much. Not really very coordinated. We tried gymnastics, did not like the whole height thing. I was okay on the floor, did okay when the balance beam was down there for the practice thing, but, they asked me to get on the top of the parallel bars, and I was like, thank you, where's the door? I'm out. So then I stumbled across the fact that I could run for a long time, and I could get there fairly quickly. So I became a cross-country runner. And our team had some decent success. We finished second in the state twice throughout my 4 years of high school. My freshman year and my junior year. So my sophomore year was the best I was ever going to be in cross country. I literally trained with the gal who still holds the Ohio record for the 1,600 and 3,200 meters all summer long, 450 miles. I was never going to get faster or better. And I still wasn't, we went to meets, I was number one on our team, but I wasn't winning the races. I was still 3, 4, 5, whatever. And I was like, wow, this is not the scholarship material that's going to get me to college. What am I going to do? Well, I better study. So I started studying a lot, to the point where my mom was like, nobody studies that much. Like, why are you studying all the time? And I'm like, gotta get out of here. Gotta study. So luckily, when I was in my off seasons from cross country, I used soccer as a way to stay in shape, so to speak. And it was just another activity where you had to run a lot, but you also got to kick the ball around, kind of fun. So with all my studying, when I took the ACT and the SAT, my scores were decent. I get a little card in the mail that says, you should apply to West Point. Literally, as I said before, no clue what I'm getting into. My mom, meanwhile, was doing backflips. She's like, West Point, what? And I'm like, whoa, what are you talking about? Let's calm down here. So again, I'm like, well, is it in California? He's like, no, it's in New York. I'm like, why do they call it West Point? He's like, well, because back then, when they made it, it was on the west bank of the Hudson River. I'm like, okay, I guess we'll... So anyway, I explored it. They send you a brochure that is gorgeous. You know, front cover. Much of the history we teach is made by people we taught. You talk to a nerd, you're like, set the hook, right? I'm in. So I sent it back and start the process to go. Now, if you want to talk about where imposter syndrome starts, when it became known in my high school that I had been accepted at West Point, there I am, I'm a senior in high school, and I'm in math class, solving a trigonometry problem at the board. And my instructor had a son at the Coast Guard Academy. And so again, I'm still really not 100% sure what I'm getting myself into. I just know it's going to be super cool, and there's a 5-year guaranteed job after graduation. So it's free. So it's meeting so many of my criteria. So there I am at the board, trying to solve a trigonometry problem, and she says, well, I guess they needed to fill their quota of women. You know, they just started accepting them a few years ago. They need to fill the ranks. And I'm like, oh. So, you know, the subtle, not so subtle implication is I wasn't qualified. She then proceeded to tell female cadet jokes, which is a special kind of joke that, yeah, I will tell two, just so you have some examples. So again, still solving the math problem. Meanwhile, she says, what's the difference between the garbage and a female cadet? Answer, the garbage gets taken out once a week. Oh, okay, gotcha. I see where we're going with this. Next female cadet joke. What's the difference between an elephant and a female cadet? I'm like, I don't know where this is going. She's like, oh, about 10 pounds, but you can always force feed the elephant. Whoa, like what on earth? So I was like, man, and like you can just feel the heat rising, and you're just like, solve the problem, focus. And in a way, though, she did me a favor, because I already knew two of the jokes I might hear in the next year. So I kind of knew what I was getting set up for. But literally, when I went to West Point, I went there with the deep belief that I didn't belong. And someone was going to come tap me on the shoulder and say, you know, actually, we just looked at your packet again, and we made a mistake. So, you know, there's the door. Have a nice day. So making that soccer team, which I did because I wasn't good enough for the cross-country team. Remember that story? And I wasn't good enough for the track team. But the day of the soccer tryouts, I made sure that anytime the coach was looking anywhere in my direction, I was running somewhere. I was juggling the ball, I was running, I was tracking, constantly moving. And so I made the team. And that team became just this core group of friends that got me through that first semester and truly through all 4 years. One of the things, though, that was very helpful was, again, like when you're on a sports team in college, time management becomes critical. And I truly learned how fast I could shower, how fast I could get dressed, how fast I could run from the athletic field to my barracks room on the 4th floor. And it was incredible. It just added an additional layer of preparation and training that I desperately needed to help me through. So at the end of the first semester, I'm still thinking I don't belong here at all. We get our grades back. And we get our first grades, and I'm like, whoa, kind of at the top of the class. Like, not the top, because I've never been the top, but I'm like, oh, so you have the little stars on your uniform, and then everybody knows you're petted. You're like, oh, star woman, okay. But it was one of the first times that I felt like, I can do this. I can do this. I belong here. This is like one of the things that is in what we call bugle notes. So when you go to West Point, there's like this little book they give you literally on the first day. And it's kind of a sort of like memorize everything in this book, and we will ask you at random moments to spell something out. And so this was one of the things that I also kind of printed and kept above my desk for years, because it's, emotional intelligence right there. Know yourself and seek self-improvement. Be technically and tactically proficient. Of course, it was a military academy. Seek responsibility, take responsibility. All these things really helped begin to teach me about leadership. One of the other things that I used to love, like some of the knowledge they asked us to remember was just so random. You would never understand what the purpose was. So when we would walk into the dinner table, one of the upper class cadets could look at you and say, how's the cow? And you would have to quickly assess how many cartons of milk were on the table and say, sir, she walks, she talks, she's full of talk, the lacteal fluid of the female bovine species is highly prolific to the 3rd degree. Say they were 3. And literally, 35 years later, I can still spout that because I don't know what. So, it's like, you think about some of the things that they did that would seem like hazing, but there was a purpose to it. They were training our brains to remember things. Came in useful in med school, let me tell you. So, again, I said luck would be sort of woven throughout this talk. And this is a quote by Louis Pasteur, which I will not repeat because Babel tells me that my French is atrocious. So, I couldn't pronounce any of that. But basically what it says is that in the areas of observation, chance favors the prepared mind. So how do you prepare a mind to be ready for chance? Well, the other quote by Pasteur that I love is, when you work 14 hours a day, 7 days a week, you get lucky. So I just spent a lot of time studying at West Point. Once I realized I was supposed to be there, then it became like a question of what was I going to do once I graduated. And you saw some of the leadership things. One of the most difficult things about West Point was I was actually terrified of being a leader, because in the Army that meant standing in front of a platoon of like 20 or 30 young men and women and telling them to do things, and giving them commands. And again, the thought of that just seemed a little overwhelming. So in what may seem like not the brightest move, it seemed like going to medical school would be easier, because I wouldn't have to stand in front of anybody and be a leader. Don't ask me why. But it literally is the truth. I just, 21 years old, all I knew was that I could take tests, I could learn things, and medical school seemed like a place to do that. used my chemistry degree, didn't know what I was doing, silly rabbit. Anyway, so we're on a journey. Every journey needs a good sidekick, okay? I had already been accepted to medical school and selected Medical University of South Carolina. And then this knucklehead, handsome that he was, starts, he'd been asking me to date me for a while, and I was like, yeah, I don't really have time for all that. I'm done. Male cadets are idiots. Think of all the female cadet jokes. Like, after 4 years, I was like over it. Quickly became just my best friend and the person I couldn't live without. So we got engaged on graduation day. I went off to South Carolina. He went off to Oklahoma to learn how to be a field artillery officer. And these two pictures kind of capture the early part and the latter part of what we had hoped would be a marathon. And in the end, it turned out to just be more like a 5K. And I just can't even think about what kind of leader I would be if I hadn't had the years of observation of watching my husband, because he was one of the most impactful, emotionally mature leaders that you could ever have known. And it breaks my heart that people here don't have the opportunity to know him. But, in 2001, he was killed in a helicopter crash. And so when I say the person I couldn't live without, well, obviously I'm still here. I had to keep going. And, part of how I kept going, you'll see with the rest of the journey. So, preface that. So again, we talked about going to medical school. Had some medical school adventures. My cute little daughter, born after my second year of medical school. And if you remember that baby picture at the beginning, we kind of look a lot alike. I mean, like, it's scary how much we look alike. Much to her dismay, of course. But, so I mentioned that I started medical school at the Medical University of South Carolina. And then again, not knowing what I was doing, because sometimes I don't think things through, I really did want to have a child. Like, this was one of the most exciting and thrilling moments in my life. But I was like, holy cow, I'm gonna literally deliver right before clerkships start. Ugh, dummy. Should, planning and timing should have been something I was better at. But I was just so excited to be married and to start a family that I just sort of, for a second lost my brain. So I did this thing where I went to my dean's office and I said, sir, I need to live in Kentucky. And he said, okay. Why don't we see if you can transfer to Vanderbilt? I'm like, okay, let's do that. So I don't think I realized how rare that is to transfer medical school. But I see Leah and Sean and going, yeah, nobody does that. Literally, nobody does that. I wrote to Vanderbilt, the dean wrote to Vanderbilt and said, we'd like to offer this student into your third year class. Vanderbilt very kindly wrote back and said, we would consider her application if her step 1 score is above her class mean. Okay, well, all right, that's no pressure. So I literally took step 1 when I was 6 months pregnant and began a year's leave of absence, because the one thing I knew in my head was I had to separate these two events, the start of the clerkships and the beginning of my journey as a mother. Best decision I ever made. Absolutely. Again, it involved writing letters I wrote the Army HPSP counselor person and I said, hey, I'd like to take a year off. And they said, okay, what's your reason? And I said, I'm gonna have a baby. And they're like, okay. So the thing I didn't know is when you take a year off, you don't get your stipend for that year. So we learned how to be very poor very quickly. Because again, we had a baby and my husband was a second lieutenant. So it was kind of interesting. But thankfully, going back to the fact that I study a lot and I'm a total geek and a nerd, I obviously did well enough on the step one to get into Vanderbilt. So that's where I finished my med school journey, and I thought everything was going to be fine. Well, you know, life has all these little crazy twists and turns. So I don't know if you recognize the map, Operation Desert Storm, just a little event that happened while I was in medical school. So there I was, third year med student, my daughter's like 10 months old, I'm ready to go, and my husband deployed for 7 months. So I was like, what? So part of the reason why she is asleep in this cute little wrapper is because I would drop her off at about 4:30 every morning at this wonderful Miss Patty in-home child care provider. And, you know, sometimes I would get home at 7 that night. Sometimes I would get home at 7 the next night. And Miss Patty took amazing care of her, and we got through it. And so I somehow managed to survive the hour drive to Vanderbilt every day, never crashed my car, never, you know, nothing bad ever happened. The war ended, my husband came home, and I finished medical school. Time for residency. Okay. I kind of love this because it's like my residency class looks a lot different from our current cohort of residents. We now have 25 women at the UH program, and I love every one of them, I do. But I really do hope our specialty continues to make room for amazing male colleagues like Dr. Baum. So, you know, it's just, these guys were great, and we had such a good time. I got to deliver 2 of their babies, and, you know, Deb Lashley and I were the only 2 girls in our cohort, and we had a blast, but also our lives looked super different because I had a second child, my son, again, timing not always my thing, and she was single. And so it was kind of funny when we would get together and we would grumble about different kind of things. Like she had nobody to be at home when she needed packages dropped off, or, you know, the things that running a household when you don't have anybody else in the household, those are things she struggled with. I just struggled with, you know, trying to feed my kids. But it's amazing how having children as a trainee helped me understand what it is like, as I lived through it, as I mentor our current trainees. So I have that perspective that's been very helpful. It also was really important for me to know how to judge programs in terms of being accepting of someone who's pregnant. So when I did my, you know, audition rotation, one of the chiefs at the time was 36 weeks pregnant. And we spent a whole night doing like section after section after section. It was kind of awesome. And I was like, yes, Bonnie Catterson, I am gonna be her. So I'm not her, I'm me. But again, it's one of those things where when I first came to UH, one of the interns was pregnant, one of the attendings was pregnant, and I knew these are my people. They accept women living their lives while they train, while they work. So, of course, over the years, one of my favorite things to do on this planet is to deliver babies. And, you know, making postpartum rounds when patients ask you, like, can I take a picture of you holding my baby? It's like my favorite thing. So, the first one is like when I was an intern, and this patient was like one of the first patients that had asked me, like, well, would you come for my delivery even if you're not on call? And I was like, yeah, I'll do that. And it kind of set up a pattern over the years that I did that for a lot of people. And, many of them ended up being at Schofield Barracks in the Field Artillery Battalion because my husband kept telling everybody, my wife is the best obstetrician on the planet. Then he would grumble when I was gone. I'm like, dude, if you would quit being my marketing team, like, seriously, I don't need extra help. But it was really kind of nice that he accepted what I did and he celebrated what I did. And I loved what I did. And so, over the years, whenever I had a really, really bad day and I was struggling with something, I would look back at the pictures and it would remind me of my why. So, have that thing that connects you to why we got into this in the first place. Okay. Most of my mentors when I was a resident were men. And that is just the way it was. We still have a bunch of men who are amazing mentors now. But over the years, I was very fortunate that I was able to find some female mentors through kind of like our FACOG district. We have an armed forces district, and that was really helpful. The gal in the red flannel, it's actually Major General Carla Holly Boland, and she was the one with the vision to bring me back to Hawaii as when she was in her role as consultant to the Surgeon General. She's one of the most amazing gynecologic surgeons and leaders and just a huge, huge friend and advocate. The person next to me on my left in that picture, Dr. Wilma Larson, is now working with the Joint Commission on reducing maternal mortality across the nation. Previously, she was at the American Board of OBGYN as the Associate Executive Director. And so I've been so fortunate to have amazing mentors throughout my years. So when I did come back to Tripler, one of the most significant events, besides the death of my husband, was the death of Mike Yancey. He was my mentor, my program director. Part of the reason why I came back to Hawaii was to work for him and with him. One of the smartest people I've ever met, just unbelievable. So Emma, maternal fetal medicine specialist. These are us holding twins that we had delivered together. And, when I came back, I was the associate program director, and he was grooming me to take his place. We had a whole timeline, everything was going to be great. His family was one of the most important support structures that I leaned on the year after my husband was killed. And sadly, just short of a year after my husband was killed, Mike died suddenly. So I took over the program under really suboptimal conditions. Just, still trying to figure out my own grief, then I was grieving his loss. It's just, what do I do with all this? So many emotions. I had a friend who had offered to, give me free therapy as a psychiatrist when my husband died. I'm like, no, I'm fine, it's fine, everything's fine. And when Mike died, I was like, you remember that therapy you talked about? Like, I think now's the time. Let's do that. So, because really I had a lot to deal with. I was a single mom, and now I was gonna run a residency program. And I was just like, I don't even know how I'm gonna make this all work. One of the first things I did was I went to the chair of the department and I said, okay, right now I'm doing two things. I'm about to run the program and I'm running the clinic. I can't do both. You pick which one you want me to do. I'm like, I'll run the program or I'll run the clinic, but I can't raise my kids and do both. And so amazingly, he listened. And it really was like this important lesson for me that, again, if you don't ask for it, nobody's going to give it to you. Nobody's going to take something off your plate if you don't acknowledge, hey, I can't. I'm going to drop this plate. So, it really, I was grateful that he let me do that. But I was also grateful that I had the strength and the courage to ask. So this quote is one that was actually spoken by my husband when he was being kind of like followed for this book that this author was writing. And it was kind of a funny story because he told me, like, oh, this guy is going to write a book about West Point. He's going to follow me around for a year. And I'm like, yeah, talk to that, whatever. I don't really think I don't know, understood that it was actually a thing until, Ed came to my office one day and like interviewed me for the book. And I was just like, wow. But I love this quote because it kind of speaks to the growth mindset, that it's okay to take chances and make mistakes, and how to create an environment where you just try things. And going back to childhood, when we talked about like I was the smart kid, I'm sure I had a fixed mindset, guaranteed. And I think still sometimes I struggle, but I've worked so hard to develop a growth mindset, and this one really, really has helped. So, what do we get to do when we go through struggles? We get to celebrate. And these are just a few of the classes that I was fortunate enough to mentor at Tripler. And I put Emily and Benny in the middle because they're now faculty at our UH residency. Some of these folks have run fellowships, some have run like departments, and several of them are in academics, and it's just, I can't even count how many babies they would have delivered over the years, and that's such a joy to me. As we went through our time at Tripler, eventually, one of these years, my daughter developed into a very challenging teenager. I wanted to rip my head off. And, it really felt like things were spiraling out of control. For an Army officer, the lack of control is anathema. We just don't really do well with that. So I got her in with the child and adolescent psychiatry fellows at Tripler. I got back in with my therapist again, and we got through it. And the reason I bring that up is because it was so important for me to be able to tell my trainees that as a lieutenant colonel, I was getting therapy and I was on the promotion list to colonel. I was like, your career will not suffer if you get help. And, it's something we deal with today with trainees. We want them to get help, and we have to find ways to destigmatize it so that they can get the help they need. So, I'm flipping along in the Army. Finally, things are a little bit settled. My daughter goes off to college. Got that going on. My son goes off to college, and now I've got a little extra free time on my hands, and I'm starting to think about, what am I going to do when I retire? I don't know. Well, one of my friends had done this master's program, and I thought, yeah, I like learning. Learning is good. So, I'm all about the quotes. Well, Abigail Adams, 1780, rocking it out. Learning is not attained by chance. Must be sought with ardor and attended to with diligence. So, yeah, that's kind of what I thought. Okay, let's do this. Go for a master's program. And it was a journey for sure. So one of the things that I found again, that whole growth mindset situation, when you are trying to grow, you are getting out of your comfort zone and into the learning zone. And so things I'm afraid of doing, like this talk, things that are difficult, delivering babies, things I've never done, jumped out of an airplane, exploring new things. I kind of am very grateful for the master's program to, kind of force me to do things that scared me. It also really opened up the doors for me to come here. And, I had lunch one time with Dr. Andrade, and she was so gracious. She's like, your CV is kind of sparse. I'm like, oh yeah, kind of raising 2 kids, running a program, didn't have a whole lot of time. But it was just the fact that she was willing to be so honest with me that, yeah, you could come work at UH, but you're going to be an assistant professor because you haven't really done anything. I'm like, okay, all right. But again, things that scare me, here I come. New EHR, new trainees, new friends. I gotta tell you, landing in Queen Emma Clinic was just a gift and a blessing because they accepted me and made me feel like a family right from the very start. And I get to teach our residents in a place where we care for people who need it. And it's just been such a blessing. And then I look at these pictures and I'm like, working here in Honolulu, working here in Honolulu, working here in Honolulu, working at UH, accepted the fellowship, and, that's my why right now, is to help make doctors for Hawaii. And this is where I'm happy to do it. So I definitely don't get it right every day. I screw up a lot. We'll have days where we're like, ooh, bad attending. Nope, not that. But I try. And they really have been very gracious in allowing me to try. So this was the last slide on my, when I had to do my master's degree, we had to do a presentation of our portfolio. And I love this slide because I really am more interested in my own comfort. I like the picture on the right. But God is more interested in my character than my comfort. And I really use that quote because, one, my pastor had used it in a sermon years and years ago. But two, because I really haven't talked about my faith today at all. But my journey would not have been possible at all if I didn't have my faith. There were days that brought me to my knees and days that still bring me to my knees. And my faith is what has sustained me. So in my, one of the things I had to do in the master's program was to write sort of like a biography. And as part of the biography, they asked us to write a leadership philosophy. And really the basis for my leadership philosophy is, to whom much is given, much will be required. I know Dr. Fong knows that's Luke 12:48. So it goes back to everything in my journey. I have been given so much, from being adopted into a family that loved me and provided opportunities, from getting scholarships. You could say, I would like to say I earned them, but for getting the scholarships, for getting the jobs, the opportunities that I had, for getting to come back to Hawaii, that has all been a privilege. And because I've been given those privileges, I'm doing my best to give back. And some days I get it, some days I don't. Of course, no talk would be complete without multiple pictures of my children. This is the day I retired from the Army. And I was so joyful this day because I felt like we had made it. We had been through really difficult challenges. Both of my children had graduated college. My daughter was maybe halfway through her school psychology degree at that moment. And I actually didn't even have the job at UH yet. I didn't know what I was going to do. And that gets back to my whole journey is not necessarily the me that wants comfort. That's not the path I would have chosen. But the me that knows that God is more interested in my character than my comfort. Just keep walking. Just keep walking. And hopefully, you've seen how luck has inspired me, how luck has guided me. And I just want to thank again Winnie and Lori for inviting me today and for just letting me be a part of your Women in Medicine Month. I appreciate it. That's all.
Thank you very much, Dr. Olson.
Okay.
I think we can all agree that was such an inspiring talk. Just you really answered our call to share your journey in medicine and your life story with us. And I think that was actually way more than we could have imagined and expected. So thank you so much for that. Very inspiring, very, courageous for you to share all of that, so to be able to hear, your journey, your adventures, your highs, your lows, but how you're able to, overcome all of that and accomplish everything that you have. And we're so grateful to have you, here with us today as our speaker, but, also as a valued member of the faculty, physician. So we're going to open it up to questions now from the audience. And actually before that, I'm going to call up Dr. Deanne Carpenter. But I just wanted to make a note that, it's kind of a passing of the baton in a sense, because we had Dr. Gwen Consejo-Lum introduce Dr. Olson. Dr. Gwen Consejo-Lum was our second Women in Medicine speaker. So that's really awesome. This is our 8th year, so you are actually our 8th speaker. And Dr. Carpenter, who is going to moderate the Q&A and facilitate the questions, was actually our speaker last year. So it's such a nice way to kind of, share all of this and keep the story going for everybody. So thank you. All of you amazing women. Thank you.
Wow.
You can, yeah, sure.
Completely impressive what you've shared with us, and just so real and genuine you are. I think it's wonderful, and I just, anyway, I was just completely inspired, so thank you. I think back, my father graduated from Kings Point Academy, so all the stories he had, not even related to yours, but
Yeah.
some are similar.
Yes.
Some are similar. But well, thank you for everything you shared. I'd like to actually open this up to the floor to see if anyone has any questions. Yes.
Well, thank you. That was a great story. I was just wondering, you had such a great adventure in your life. Have you had any regrets in your journey?
Of course, Kathleen would ask this question. So the question, in case you couldn't hear, was with all of the wonderful opportunities you've had in your life, were there any regrets?
Yeah, it's funny you ask. We talk about being afraid of things. My freshman year of high school, that was the year we finished second in the state in cross country, and because we made it to state and that extended our season so long, I had actually missed the tryouts for women's basketball, and I really wanted to play women's basketball, but because they had already had the tryouts, I didn't. I didn't go, I didn't try. And I've always looked back on that as a little bit of a mixed blessing. It's like, could I have also been a basketball, could I have been a 3-sport athlete? I don't know. But it always was like a little bit of a lesson to me later to try things. And I kind of did regret not trying. But over the course of my high school career, I also felt like, yeah, but it was kind of nice to have a break between cross country and track. And so even while I regretted it, I think it had value. Does that make sense?
Yeah. Thank you.
Sure.
Awesome. Any other questions? Yes.
What are your hopes for the future of women in medicine? What would you like to change or improve?
Yeah, that is such an awesome question. So the question is, what are my hopes for women in medicine in the future, and what would I like to change or improve? I think I want to continue to improve the working environment where, again, women are accepted as they are in terms of the choices they make. Women in medicine have always struggled, whether they choose to have children or don't choose to have children, or the timing of their children and how they raise their children. And so I think creating an environment that is just accepting of every woman as she is and her choices that she makes is so important. And, when I talk about choices that women make, having access to family planning is critical for women to be able to plan. Obviously I had my kids in medical school and in residency on purpose. That was my choice. But it's not the same choice everybody else should make or could make. I had a lot of resources that were very helpful for me along that journey. It blew my mind when I got out of the Army and I found out how, civilians don't have the same rights in terms of, postpartum leave. I was like, what do you mean you don't get 6 weeks off? We got that in the Army. I thought we were, it just blew my mind. So I think, again, making sure that women have access to what they need, that is critical. Making sure that our work schedules are flexible. And, so the times I worked super hard over the years, those were my choice. I chose to get up at 3:30 in the morning to drop my daughter off at 4:30 so that I could, that was what I needed to do in that moment. But people should be able to, make a path that they can navigate without other people, judging them, or without the system, considering them unworthy because their schedule doesn't look like someone else's schedule. Does that make sense? Yeah. So I want to keep making it better, one day at a time, little by little.
Awesome. I'm thinking the other part to that question was actually, what are your next steps, and how are you going to do all that and do that change in the world and make all those wonderful things happen for everyone else? Part of it I know you're already doing in your present capacity.
Yeah, so one of the things that I had intended to talk about that I of course forgot because when I speak I get nervous, was the opportunity that I had after coming from JABSOM to learn coaching. Like Dr. Otsuki sent me to a course to learn how to be a coach, and I think that's really kind of part of the journey is there's no way I alone can change the world, but if I coach other women to rise to their full potential, then together we can all change the world. So that's my secret plan.
I
It's,
love that exponential secret planning. I
Yeah.
really like that.
yeah.
Yeah, any other questions from the audience?
And it's okay if there aren't.
Polly secretly asked, can you please not ask any questions? And I said, no, I'm gonna drag it out.
I'm like, I must ask questions.
I just really, wow, I could resonate with everything you mentioned about all the opportunities, about how to be real and how afraid you were, but then in that growth mindset, in that learning, in that your own personal and professional growth, the more steps you take, the more steps you can take, and pulling others along with you, which I totally see that you're doing. So I just want to thank you for your sharing, for your authenticity today, as it's just, I think, really inspired others. And I think just in the room alone, we will inspire others because of what you said and continue all those lovely quotes. So mahalo, mahalo, really.
And like a final note, in case anybody didn't recognize the song when you came in, I Am Woman by Helen Reddy, 1972
Right.
was when, and so I grew up in the era of records with the hairbrush in front of the mirror singing that song.
Still do that today.
And I had no idea that, like, how impactful, when I hear the words now, and she talks about the wisdom that comes from pain, I'm like, whoa, that's the song for today.
Right.
There will be pain, but there will be wisdom.
So acknowledge that and take it, lean into it. Awesome.
Mahalo.
Mahalo, mahalo.